it's Megs with Megs Rx for Life, your pharmacist, helping you guys get that healthy bod and that blissful heart. Today is my third video in my new Pharmacy Pro Tip series. Today I'm going to talk to you guys all about azo, aka phenazopyridine, so please make sure you guys subscribe and stay tuned for more. I wanted to start off with some numbers first. So urinary tract infections are the second most common type of infection in the United States. And they account for around 8 million doctor's office visits every single year. So not surprisingly, they are super common, and as a pharmacist, I see prescriptions for them all day long. And usually if you go to your doctor and you have a UTI, your doctor will prescribe you two medications, phenazopyridine and an antibiotic. Now the issue here comes with the phenazopyridine. So phenazopyridine is actually available over the counter, or OTC. So your insurance company, when they see a claim submitted for phenazopyridine, they oftentimes think to themselves, they can just buy it without a prescription. There's no reason for me to cover this. So they just say, we're not going to accept it. You can pay out of pocket and buy it at the pharmacy. There's other people whose insurance companies do actually accept it and they can get it with us. But the issue is that our phenazopyridine that we have behind the counter, for some reason, is a lot more expensive than the one you can actually buy OTC. So that is where my pearl of advice is going to come in. Alright guys, it all comes down to my moment of truth. So for my pearl of advice, so next time you or someone you know goes to a pharmacy to get a phenazopyridine prescription, number one, if they hear that their prescription is not covered by the insurance and the pharmacy is going to dispense the phenazopyridine there, or number two, the prescription is covered by the insurance, but the copay is anywhere between $30 and $40, do yourselves a favor and say no. All you have to do is just ask to have the pharmacist or a technician show you where the OTC phenazopyridine is. So you're going to go out there, you're going to have to look on the back of the boxes, and you're going to look for the active ingredients. So they're going to be next to the azo. It's just that azo has a ton of different products, so you're going to have to look. So you're going to look on the back of the box, you want to find the phenazopyridine, and it's going to be a 95 milligram or a 97.5 milligram. And then once you find that azo that has the phenazopyridine, you're going to look at the box right next to it. That's going to be the generic equivalent. Because you know what? You don't need to spend that extra money on the name brand. Just get the generic, has the same ingredients, it's just as effective. Now, I know what many of you are thinking. Hold on. So my prescription is for 200 milligrams of phenazopyridine, and you're trying to sell me the 95 milligram or the 97.5. No, thank you. Okay guys, all you have to do is just double up on your dose. So take 2 of the 95 milligram or 97.5 milligram, and you're gonna have your equivalent or nearly equivalent dose of the 200 milligram phenazopyridine. So this will save you some money, and then you guys also don't have to sit there waiting for your antibiotic while you're having horrible burning pain. You can just go ahead and pop 2 of them right away, and you can just sit there and wait patiently for your antibiotic prescription. So I feel like some of you guys are going to be like, I don't really think she's saving me that much money. So I want to give you guys some numbers so you have an idea. So I have my handy dandy little note paper, and at the pharmacy where I work, so if you come in and you have a prescription for phenazopyridine 100 milligram and you have a prescription for 12, so that's only for 2 days if you're doing the typical max dose in a day. So the cash price is $29.99. Now, maybe you're thinking, it's honestly not so bad, I'm not so worried about it. Well, if I tell you that the OTC version of the phenazopyridine, the 95 milligram, if you buy 30 of those, it's $6.99 without a prescription over the counter. Okay, so that is a pretty big savings on that. So I would say I would definitely go for it. And then if you had a prescription for, say, the 200 milligram phenazopyridine, and you're getting, again, just 6 of them for 2 days, that cash price on that is $24. And like I said, you can just buy the OTC version, the $6.99 one for $30. That's the better way to go. So use my pearl of advice on that one, guys. So hopefully you guys are going to have some relief while you're sitting there waiting at the pharmacy while they're filling your antibiotic. You're going to have that phenazopyridine. You can just go ahead, buy it, take it while you're waiting so that you're not in miserable pain while you're waiting for your antibiotic. And then I also wanted to give you guys some important counseling notes on this one, since it is kind of a unique side effect with it. So if you've never had the phenazopyridine before, it's going to turn your urine a bright orange. And that's totally normal. You don't have to be freaked out about it. It honestly just comes with the phenazopyridine territory, so don't be worried about that. It's just basically going to numb your bladder so that you're not going to have the burning with urination, and usually it helps with the urinary frequency also. And the important thing to note with this is that this is not going to treat your urinary tract infection. So you guys need to wait for your antibiotic. You need to pick that up because nothing is going to go away unless you take your antibiotic. Don't forget that, guys. Alright guys, that's all I have in store for you for today. Please make sure you guys subscribe to my channel if you haven't already, and stay tuned next Monday. We're going to have another pharmacy pro tip video.